Having your tooth dislodged from the socket, either as a result of trauma, an accident, or sport injury, can be a very devastating situation. But did you know that you can actually have it reimplanted? Welcome back to the channel, guys. I'm Dr. Neye, and today I'll be talking about an avulsed tooth. An avulsed tooth simply means a tooth that has been disconnected from the socket completely. It's just like when you do a dental extraction and you extract the entire tooth. But just that in this case, instead of the dentist pulling out your tooth, it came out as a result of either trauma during an accident or sport. Now, this is actually a dental emergency and requires prompt and immediate treatment. The common causes of tooth avulsion could be as a result of trauma, like maybe while playing sports or falling down from your bike, or maybe an accident, a road traffic accident, or maybe a blow to the face, or something forceful was applied on the tooth that pulled it out from the socket. The usual symptoms would be the fact that you have a missing tooth, so your socket is actually empty. There'll be bleeding and there'll also be associated pain. When it comes to the management of an avulsed tooth, early intervention is important. The quicker it is reimplanted, the higher the chances that that tooth will actually stay in place. And what can you do as the individual who has the avulsed tooth? The first thing you want to do is pick up the tooth from the crown. The tooth has two parts. The crown is what you actually see. The root is inside the bone. You don't want to touch the root. So pick up the tooth from the crown and give it a good rinse in clean water or some milk to take off any attached debris. Now, once you've done that, if you can, put it back into the socket as firmly as you can and bite on a piece of gauze so that it can be firmly attached. Once that is done, please make sure you visit your dentist immediately for follow-up. Please note that you cannot reattach a baby tooth, because if you try to reattach it, you may end up causing damage to the permanent tooth that is right above it. We do not reattach or reimplant baby teeth, only permanent teeth, and usually the ones in front. If for some reason you can't reinsert or reimplant your tooth, you need to keep it moistened. So one thing you may want to do is place it in a glass of milk or in a solution we call normal saline solution. Or if possible, you can place it at your cheek, the corner of your cheek, so that your saliva can actually help to hydrate it. And then hurry to visit your dentist. Now, once you get to your dentist, if you were able to reimplant your tooth, he or she would want to make sure that you positioned it properly. Now, if it was not reimplanted, the dentist will have to reimplant it and position it properly. Now, note that all this will be under local anesthesia so that you don't feel pain during the process. Now, once the tooth is reimplanted and positioned properly, it will need to be splinted. The aim of splinting is to make sure that the tooth does not move. You want it to set in place, so it will be splinted against the other teeth and kept in place for about 4 to 6 weeks until the mobility stops. Now, once the tooth is being splinted, there will be need to do a root canal treatment. Remember that the tooth actually came out from the socket, so that means that the blood vessels and nerves were cut off. So a root canal treatment will be done to take off the remaining pulp inside the tooth so that it can prevent an infection and increase the chances of that tooth surviving. You'll be placed on antibiotics and pain medications. If your tooth was actually exposed to dirt, there is a chance you will need to get a tetanus shot just to prevent any tetanus infection. If you are unable to actually hydrate the tooth, there is a high chance that the tooth will dry off too much, and that means that the periodontal ligaments that help to attach the tooth to the bone will die off. If this happens, reimplantation may not be possible, or even if it is, it may not work. That means that you need to plan towards having a prosthetic place, maybe a denture, a bridge, or an implant. Once the tooth is reimplanted, you need to avoid foods that are too hot or too cold. You'll be placed on a soft diet for a few weeks. You will need to brush with a soft bristle toothbrush so that you don't traumatize the tooth and cause yourself some pain. You may also be prescribed an antibiotic mouthwash for a few weeks, as well as pain medication to take care of any pain. Regular checkups of the reimplanted tooth will be necessary, so make sure that you visit your dentist as often as you can. So how can I prevent an avulsed tooth? Now, when it comes as a result of an accident, there's really nothing much you can do. But if you tend to play sports, especially contact sports like football, there is an appliance we call a mouth guard that helps to protect your teeth from such heavy impact. So plan to have that in place so that you don't end up having to cause damage on your teeth. Regarding the outlook for a reimplanted tooth, remember that prompt post-treatment is actually important. Now, this particular tooth can serve you as long as possible, but of course, there is always no guarantee as to how long that will be. So making sure you practice good oral hygiene, it's important, and also regular dental checkups so that the tooth can be examined periodically to see its state as time goes by. So we've come to the end of this video. Please like, leave a comment, and share this with someone, and also subscribe so that you can get notified when I post new videos, and I will see you in the next one.